Today, I want to talk about the impact of ejaculation on your prostate. Specifically, I'm going to answer the question, does ejaculating every day help or hurt your prostate? There are so many myths and misconceptions out there that I think it is important for men to know the truth about prostate health. As a doctor, I've personally seen firsthand how devastating a prostate diagnosis can be for a man and his family. But the good news is that there are simple things you can do to keep your prostate healthy. In fact, one thing you can do right now is start getting regular checkups. Yes, it's important to be aware of all the risks and warning signs, but it's equally important to have a proactive approach to your health. In this video, I'll dive into the latest studies and research to uncover the impact of ejaculation on prostate health. I'll also discuss the 3 most common prostate issues men face as they age and share my top tips for keeping your prostate healthy and happy. So stay tuned. Let's start by understanding what the prostate is and how it works. Simply put, the prostate is a small gland in the male reproductive system that produces seminal fluid. This fluid nourishes and transports the sperm. Did you know that your prostate produces about 30 to 50 milliliters of fluid each time you ejaculate? And yes, during ejaculation, the muscles around the prostate squeeze to help move the fluid along. This is completely normal and actually a healthy part of the male reproductive system. Now let's address the elephant in the room. How does frequent ejaculation impact your prostate? Well, thanks to modern science, we actually have some solid data to work with, and here's what it reveals. According to a large study that followed over 30,000 men for nearly 2 decades, those who ejaculated more frequently, roughly 21 times per month, had a lower risk of developing prostate cancer. This finding was consistent across various age groups and was independent of other risk factors. The theory behind this protective effect is known as the prostate flushing hypothesis. Essentially, ejaculation helps flush out old or damaged cells from the prostate, reducing the risk of inflammation and abnormal cell growth. While more research is always welcome, this study suggests that moderate to frequent ejaculation can be part of a healthy lifestyle for prostate health. However, it's important to remember that ejaculation isn't the only factor influencing prostate health. And while the study shows an interesting correlation between frequent ejaculation and lower cancer risk, it's not a guarantee. Other factors, such as genetics, diet, and overall lifestyle still play a significant role. So make sure to take a holistic approach to your health and consult with your doctor about your individual risk factors. That being said, it's crucial to be aware of the warning signs of prostate issues. And here are the top 3: difficulty starting urination, a weak or interrupted stream, and waking up multiple times during the night to pee. Ignoring these signs can lead to more serious complications down the road. So please, if you experience any of these symptoms, schedule an appointment with your healthcare provider. Alright, now that we've got the basics covered, let's explore what actually happens to your prostate as you age. The prostate, like many other parts of the body, can undergo changes as we get older. These changes can affect its function and overall health. Let's discuss the key changes that occur in more detail. 1. Enlargement and fluid retention. As men age, the prostate can enlarge, which can lead to fluid retention and difficulty emptying the bladder completely. This can cause discomfort and increase the risk of other prostate issues. To manage this, consider adopting a healthy diet, rich in fruits, vegetables, and whole grains. These foods can help reduce inflammation and support overall prostate health. 2. Hormonal shifts. Testosterone levels naturally decline with age, and this can result in an increase in dihydrotestosterone, or DHT. DHT can stimulate the growth of prostate cells, leading to further enlargement and potential urinary problems. While there's no way to completely prevent hormonal changes, regular exercise and a balanced diet can help maintain healthy hormone levels. 3. Higher risk of abnormal cell growth. As we age, the risk of abnormal cell growth in the prostate increases. This can lead to conditions like prostate cancer or other prostate-related diseases. However, it's important to remember that aging alone doesn't automatically mean you'll develop these issues. Regular checkups with your doctor, including PSA tests and DRS, are crucial for early detection and management of any potential problems. By staying proactive, you can take charge of your prostate health and overall well-being as you age. And speaking of age, let's delve into a bit more detail about what happens after 40. Starting around this age, men begin to produce more DHT, which leads to prostate growth. Lifestyle factors like obesity can exacerbate this issue. That's why maintaining a healthy weight through diet and exercise becomes increasingly important. Additionally, men over 40 should consider adding prostate-specific supplements to their routine. One supplement that stands out is saw palmetto. It's a herbal remedy used for centuries to improve urinary symptoms related to BPH. Another popular option is selenium, a mineral that has been shown to reduce the risk of prostate cancer. However, it is important to consult with your healthcare provider before taking any supplements, as they can interact with other medications or have side effects. Remember, knowledge is power. By understanding the risks and warning signs associated with your prostate, you can take proactive steps to protect your health. It's important to be vigilant and prioritize your well-being. So if you notice any changes or experience any symptoms, don't hesitate to seek medical attention. Early detection and treatment can make all the difference. So what if you've made positive changes to your lifestyle and are still experiencing prostate issues? Are there other options available? Absolutely. Let's explore some cutting-edge advancements in prostate care. One promising development is the use of low-level laser therapy for treating BPH. This non-invasive procedure helps improve urine flow by vaporizing excess prostate tissue. Another option is aquablation, a minimally invasive technique that uses water to remove enlarged prostate tissue. This allows for precise treatment with minimal damage to surrounding areas. For those seeking alternative therapies, acupuncture has shown some promise in alleviating prostate symptoms. While more research is needed, many men have reported relief from their symptoms through this traditional practice. Regardless of the path you choose, it is important to have open discussions with your healthcare provider to determine the best course of action for your individual needs. Remember, you're not alone in this journey. Reach out to support groups or online communities to connect with others who share similar experiences. Sharing your story and learning from others can be incredibly empowering. Together, we can navigate the challenges of prostate issues and advocate for our own health and well-being. Now I want to talk about a topic that many men are uncomfortable discussing, but it's crucial for maintaining prostate health: ejaculation and orgasm. Let's shed some light on this often misunderstood aspect of men's health. Ejaculation and orgasm are natural and healthy expressions of sexual desire and pleasure. However, it's important to understand the frequency and intensity of these activities can impact prostate health. While moderate ejaculation can be beneficial for prostate health, as discussed earlier, frequent or intense ejaculation may cause discomfort or even pain in some men. It's essential to listen to your body and take steps to ensure your comfort and well-being. Maintaining a healthy lifestyle, including regular exercise and a balanced diet, can help reduce discomfort associated with ejaculation. Additionally, staying hydrated and practicing relaxation techniques such as deep breathing or meditation can aid in managing any discomfort you might experience. Remember, it's perfectly normal to experience discomfort or pain during or after ejaculation. And seeking professional help to explore underlying issues or concerns is a sign of strength, not weakness. Maintaining a healthy prostate is essential for overall men's health and well-being. By understanding the changes that occur in the prostate as we age, adopting a proactive approach to screenings and treatments, exploring alternative therapies, and prioritizing self-care, we can take charge of our prostate health. Remember, knowledge is power. Stay informed, stay engaged in your health, and don't hesitate to seek support and guidance along the way. Together, we can navigate the challenges of prostate health and advocate for our own well-being. So take care of yourself, stay proactive, and live a healthy life.